Good afternoon, everyone. Welcome as people come into the Zoom. So reintroduce myself. My name is Kelly Brown. I'm with Viewpoint Consulting. Would like to welcome you to the third in a series of 5 webinars being offered by the California Demographic Data Collaboration, a collaboration between the James Irvine Foundation, the Weingart Foundation, and the California Endowment. As we've mentioned in the past, this series is designed to strengthen nonprofits in California with respect to their use of data in general, but specifically around demographics and demographic data, primarily to increase learning and opportunities, to reduce burdens on the nonprofits that they're mutually engaging, and to strengthen their shared commitment to equity and justice. So as folks are coming on, as I mentioned, my name is Kelly. I will be guiding you. I've been facilitating these conversations and will be guiding you through today's conversation in partnership with my colleague, Jason Alexander. Again, he is a consultant and the CEO and co-founder of Capacity for Change, along with my former colleague, Megan McVetti. He's worked with many foundations and nonprofits and has been a HUD consultant on one of their key projects. I'm looking around for his full bio, but I think he can give you an update once we get closer. But Jason has worked closely with a number of public and private organizations around collecting data, and we'll be in conversation this afternoon around some key strategies and takeaways. We're also joined, obviously, by our colleagues at the 3 foundations. It looks like Kelly Martin and Joyce Ibarra from Weingart. So today, as I mentioned, we're going to be talking about data collection strategies. But before we move into that, I just want to give a quick summary of the first 2 sessions. Again, a reminder that all of these sessions are being recorded and will be shared at the end of the full series in addition to supplemental materials. So you don't have to take a lot of notes, they'll be shared for you, but we did want to just give some recaps of where we started in the first session, which was focusing on the why. Why is demographics important? Why is it important to what you do? And how you do what you do, and how do you understand how to use it and deploy it to strengthen your programs. But also to surface that demographic data is essentially data or conversations around identity, and that can sometimes be charged. So we really want to support people in their efforts to engage critical, but often sometimes complicated questions. In the second session, we went over the actual taxonomy, how you categorize the data, how you categorize people, what terms to use, how to think about demographic terms, how to strike the balance between designing data collection tools that are inclusive of as many people as possible, but are also not burdensome to folks who are responding. And to remind folks that these things change over time because communities and people and how they identify change over time. And so as you're designing your mechanisms, be prepared to make changes. As I mentioned, I also want to say before we go over the agenda is that we're going to transition in kind of the second half, or maybe the second 2/3 of the conversation today, to be in conversation between Jason and myself. But we do encourage folks to utilize the Q&A function to ask questions of as we go along. We'll pause in the middle to surface questions that you might put in there, but we'll ask that people use that function to surface your questions, and my colleagues and I will be watching and monitoring that so that we can engage you in the conversation as well. So what we want to cover today is collection strategies, and really trying to help people differentiate between the kinds of data and the processes of collecting demographic data from organizations on behalf of others, and demographic data from individuals. We'll lay out a couple of frameworks to just kind of help you think about how that data flows, and hopefully it will help you not only think about your own processes, but also engage your peers and funders in terms of what it takes to engage this data. We also want to stress the different kinds of data, make sure that people understand what different kinds of data can tell you and do for you, and some pros and cons of each, and helping folks understand what is the best way, depending on your needs, to engage demographics. And then we'll transition, as I mentioned, into a conversation with Jason about actual strategies and good practice around collecting information and around actually engaging a range of individuals around these questions. So I want to start today just quickly with a little bit of a framework around what is the process of engaging organizations around data in general, but particularly on data that is requested of individuals and to be reported in the aggregate. And some of this may seem sort of intuitive, but we break down this framework and flow so that people can really understand what goes on within an organization when they receive a request for information and all the steps that happen before they can actually share it out through to whoever is requesting it or even whoever is using it. And this process happens whether you're an organization that's the size of 3 or 300. And I found this framework helpful so that people can understand that all along this process, there are opportunities for people to have roadblocks or for there to be drop off or there to be barriers to getting the data that you need and that is being requested of folks. So this is just a flow chart to help you think about that process. The other aspect that it's important to sort of lift up, and again can seem implicit and taken for granted, is that particularly when you're collecting demographic data or characteristics of individuals and then reporting it in the aggregate, you really are trying to balance a number of different things. One, you're trying to get as much data as possible from as many people as possible, often whom are very different kind of people. So a general population is your potential audience. You're trying to capture the dynamic debates around demographics that we touched on in the last session and how that can sometimes be evolving and may differ between individuals, even within the same organization. And then you're trying to get that data, organize it, categorize it, and then share it out on behalf of your organization. So again, this is a framework to help you think about how to balance all of these imperatives. And given these imperatives, what is the best way to get the data that's being requested? So I want to just go through again the different kinds of data. And we wanted to tease this out a little bit is because people often kind of conflate these things or are not often sort of really clear on the difference between data you get from a survey and data that you get administratively or as part of a process. So data is survey data. We've all done surveys. We've all responded to surveys, and it's really data that is collected by asking a specific group of people some specific questions at a specific point in time. And when you do that, some people will respond and some won't. And it's really important to understand that when you send out a survey, you'll get a response rate. You almost never will you get 100% response rate. And unless, we'll get into more detail about the sampling, but unless you've done a lot of work to understand the population beneath who you're sending the survey to, it really is only data on the people who responded to the survey. It's often collected by researchers or organizations for a specific purpose and to ask a specific question. Administrative data, on the other hand, is data that's routinely collected as part of a process, and it applies to everyone. So, for example, it's people's personnel records. When organizations or clients are coming into some kind of service process, people ask these questions when you go to the doctor. The EEOC requires this data for compliance. So it's really data that is attached to an individual and it is collected, and the kind of data is collected has to do with either regulatory requirements or things that tell people something about the process of doing business. So your income, for example, is administrative data because it's information on everyone, and it can be used again for reporting, but for fundraising and for operational purposes. The difference between this kind of data is as we've laid out, but there are pros and cons to both when you're thinking about particularly collecting demographic data on what tools is going to be most appropriate for your purposes. So again, if you're using a survey to collect this data, the pros are that it's easy to deploy. You can ask questions in a format You can get a list of people that you want to send it to. You can share it out and get information. And the other benefit of using surveys is that it can also get information on attitudes or sentiments. You can get sort of some other general feedback or answer other questions using a survey. The problem with the survey, however, the cons, as I sort of alluded to before, is the data that you have really depends on who responded. And there can be a lot of bias and differentiation between the people who respond and the people who don't. And so without sort of really having a good understanding of that underlying population, and doing a lot of sampling and an organization in terms of who you deploy the survey to and how you do follow-up and what have you, you really have to be careful and almost can never make inferential claims around survey data. It's really, you can only use the data and make claims about those who actually responded to the survey. Another key issue around using surveys is that how you frame questions and how you frame the questions can significantly reflect the responses. And as we know, because we've all done a million surveys or not done a million surveys, we've been bombarded with them. Using surveys can often get much lower response and much lower levels of data because people just are fatigued with them and don't respond. Administrative data, on the other hand, is more accurate and complete because it's collected from everyone as part of a routine process. So again, like upon hiring or joining a board, people get this kind of data and can attach it to an individual. So it's a little bit more complete, and it allows for a flexible kind of analysis so that you can use this data to ask different kinds of questions, and also to I'm sorry, I looked at the chat, and also to analyze this data over time. The cons of administrative data is it's limited in scope because you can only ask so many questions, personal questions or individual questions of folks along the way. And if you don't update it regularly, then obviously it becomes out of date. So you have to acquire or make sure that the data is updated as new people come into your situation, as your clients, as you get new employees. You have to be sure that you're requesting that data to keep it up to date. So we want to share with you that often things that surface when people are requesting demographic data is that there can sometimes be resistance for a number of reasons to sharing this data. And one good way to get around or to mitigate that resistance is really to share the purpose, why you're asking these questions, whether you're asking it through a survey or whether you're asking it administratively, and how you're going to use it. Studies have shown that being clear and transparent around your request around this data will reduce non-response. It's always important to emphasize that always under any circumstances, whatever tool you're using, it's voluntary for individuals to provide this kind of data on themselves for any reason. But we wanted to just also surface that there are some reasons why people resist. Sometimes it's privacy concerns in terms of not being clear or not maybe trusting how the data will use. And this sometimes surfaces even when you're transparent and you use disclosure. People can sometimes not trust that. Sometimes people resist thinking of themselves in certain kinds of categories, in general, the category that you laid out. Sometimes the resistance is association of these kinds of questions with partisan or political issues. But most of the time, most people are very used to answering these questions. We've all answered them in a variety of settings. Sometimes we answer them, sometimes we don't, but usually it's not a big deal. And point of fact, a lot of research has shown that people are much more sensitive when being asked questions about their wage, their earnings, or their income than they are about certain demographic characteristics. And we want to be sure that when people come across resistance, again, whether it's through a regular process as part of your organization and administratively or intake or through a survey, to recognize that while some people may resist being asked these questions and getting this information, most people will respond, and most people also want to be seen, and many people want to be seen and counted. And so you shouldn't assume that because some people resist, and it will usually be a relatively small number, that most people find is these questions intrusive or inappropriate. Most understand the need for them and why it's important. And we want to point this out is because sometimes the resistance and the pushback can be quite intense and very vocal. But you have to be sure that you're balancing that vocal resistance with many other individuals' desire to be seen. We also want to point out too that when people are queried and they provide answers to these kinds of questions, particularly open questions, that people are thoughtful about reviewing those responses. Sometimes they can be personalized, especially in an intake session, and Jason will say more about that when we conversation, to be thoughtful and respectful about those open questions, but be sure that you're mitigating and being judicious in sharing responses that might be personalized or offensive. So while I've given you this kind of you've gone through it quite quick. I saw some questions of whether or not these will be shared. It absolutely will. The deck and all the webinars will be shared. But I want to just do another poll and see how folks on the call are collecting this data. We know from previous polls that that many of you are engaged in demographic data in some way, whether it's about your constituents or your stakeholders, and there may be some variations. How are you collecting that data now? So we're getting some responses, and I see some questions. Before we get to the formal pause for questions, is there anything pressing that's surfacing?
Just one question about right now, are there captions available? If not, I'm sure we'll make sure we have that next time, but just wanted to ask you that as well.
Perfectly. There probably is captions, and I can do turn it on behind the scenes in real time. I will, but thanks for raising that. So let's see what's happening in the survey. Most people ask, a few people guess, and some people do something else. I'm curious if people can put in the chat how else they get this data if they don't ask guess or just no. The chat is disabled. You could put it in the Q&A in that case. That might be helpful.
Oh, Kelly, just to raise that we're hearing that the chat is disabled.
Yeah, I saw that. So I will disable it. But in the meantime, if people can put their responses in the Q&A, there's something else responses. I'm going to end the poll because it looks like most people have responded. That's your results. Most people ask, a few people guess, a few people do something else. So before we go to questions in the chat, I want to summarize a little bit about the key aspects of collecting demographic data. We want to emphasize that you're explaining the purpose for which you're requesting the questions, how you're going to use it, be prepared for people to ask the questions and react to them. Emphasize how data that may be personally identifiable will be used, and that all data will be kept secure and shared in the aggregate. Stress consent, ensure that whenever you're asking these questions, and we saw that more people are asking them, asking individuals as opposed to guessing, that it is voluntarily provided and self-reported. Differentiate between confidentiality and anonymous. So confidential is people can know who the data is associated with, but there's an agreement about how it will be shared and with whom. Anonymous is data that cannot be associated with an individual. And then we'll get into these last points more with Jason in terms of collecting data in respectful and culturally responsive ways and being conscious of collector bias. We do want to emphasize again, while we saw some of this in the poll, that some people do guess, most people ask, and it's really, really critical that when you're getting this information from individuals, that you really ask and allow them to self-report, because it's just out of pure respect that you don't want to assign or assume anything about one's identity, and also don't want to be in a situation where you are sort of pressuring people to respond to questions that they don't want to respond to. So be sure that you're establishing processes that allow you to ask. And when people don't share their information or choose to decline to answer, that is actually a data point that's valid. So let's see what's in the Q&A.
Sure. So we have a few responses on what are some other things that they do. So we mostly guess, but do ask some questions when people register for events. We do policy advocacy on behalf of classes of people. We access publicly available demographic data, but most often US Census. Someone else also gets the US Census, or partner with other organizations who collect data. Another one, we utilize a number of survey platforms and instruments. And lastly, we use reports that exist that are done by other groups, for example, Center for Nonprofit Management or Pew.
Great. So those are helpful uses, and it's really helpful that folks shared that, is because when we did the research with nonprofits, we really did see that a lot of folks were accessing kind of larger data sets and publicly accessible data sets. And I think Jason can also share a little bit more when we transition now into conversation with him about how those data sets are accumulated and how organizations can connect to their data to those larger data sets to make use of them. Are there any other questions that people have?
We have a few more. One, there are some data sources where they assume people's races / ethnicities, like the RIPA data, police stop data. What about working with that type of data? So I guess they're just trying to asking about, how do you feel about working with data that other people collect, but it's assuming people's race and ethnicity?
Well, I think, obviously if you're, we're trying to give best practices to people who are in the data collection process themselves. But I think this is also why we stress the importance of understanding and having data literacy, so you know what is good data and what is bad data, because if you don't have good data and people are assuming, then what you do with that data will be effective. Obviously, if it's not really accurate and not self-reported, then the limitations on the reliable use of that data are real. And so obviously you can't change someone else's data source, but I think my advice, and Jason can maybe jump in when we move to that, is to be cautious about making too many decisions based on that data, because you can't really trust its viability or its validity when people are guessing, because people guess a lot of different things around people's, particularly their race and ethnicity, and certainly their sexual orientation.
Do you want to hold for now or take some more questions?
Let's have some more. Is that okay?
All right, we have one more. How are folks navigating gender identity? So far, our numbers are so low, they are barely registering. We think it's important, but not sure how to navigate.
Right. Well, this is an interesting kind of arena that I think we're in now in terms of people feeling comfortable asking about a gender identity. I think what we shared again in the last session around how to frame those questions, and that they are much more prevalent is some indication that that people who identify as transgender are much more open to being seen and captured in these processes. And so what researchers are learning is how to phrase questions in ways that are respectful and appropriate and intensive. But again, I think it's one of those situations where you provide the opportunity for people to be seen, but you make sure that you are not requiring people to report if they don't want to and are not comfortable, because there could be a lot of reasons for that. And when someone says, the numbers are so low, the numbers are actually quite low. The point is that now while they may be low, 10 years ago, before we were asking these questions, they were non-existent because they weren't even in the, in the query process. It's an important arena to understand as well, that it is a very, very active evolutionary space right now, where folks in those communities are really actively trying to grapple with how to be seen and how to be referred to and how to be known. So we encourage people to ask the questions, but to still expect that there may at this point not be a lot of responses.
Another question, or you want to hold for now?
Do we have a lot?
Get two more.
Okay.
They're coming in.
Yeah.
Okay. All right. I'll do one more. So this one's about limited English proficiency. So if a funder requires data on people with limited English proficiency, what is the best way to get that data? Should we assume that if they are receiving services in a non-English language and have not identified English as one of their proficient languages, they are limited English, or should we ask every applicant? So basically, similar to what we talked about, but in regards to English proficiency, should they kind of make assumptions or should they ask?
I think you should always ask. I think that's the default, because those are just areas where the assumptions will be will be faulty and unnecessary, and it just will not necessarily yield appropriate data. And again, people, it's better to ask and know than to ask or than to not ask and not know, or to ask and then people don't tell you. They always have that option. So I don't think people should be concerned or afraid of asking, because if people are concerned, they will tell you, but they will also give you an answer, and then that way you'll know and you won't have to assume or guess. So if there's one more question, let's get in conversation with Jason, and some of those questions I think might be able to be answered through Jason's conversation. As I mentioned, he works closely with many government agencies in the Philadelphia area, collecting information from individuals through a variety of platforms and mechanisms. And his background and experience is how to ask these questions of vulnerable people, how to frame and build the questions in ways that don't provide a burden, and just different strategies for how to do it respectfully. He'll also cover some topics around privacy and coalitions. So Jason, I want to give you just an opportunity to say a couple of things about your background and what you bring to this, and we'll just get in conversation. And some of the questions in the Q&A will be maybe best answered by you.
Great, thank you, Kelly. I'm really excited to be here and talk about this with all of you. As Kelly mentioned, I'm a principal and co-founder of Capacity for Change with my partner, Megan McVetti. We actually work both regionally and nationally with public, nonprofit, philanthropic organizations, as well as public-private partnerships, coalitions, and collective impact initiatives. And this is all we do. We work on strategy, partnership, and data. And I would say in the 20 years I've been doing this, it's a constant evolution of learning how data can really inform and drive your strategy. And so there really isn't anything I work on that's not data-driven. And in many cases, I am responsible for overseeing data collection processes for various types of organizations. So I'm just really here as a practitioner, not necessarily a theoretical expert, but I think what I've learned over time is that collecting demographic data is really hard. The more you do it, the more confident you are, the more you understand the nuances of how to do it well and thoughtfully and usefully. But it's like many other things. The more you do it, the more you learn about the next layer or level of nuances and challenges and doing it well. So for us, data is something that many organizations, and I imagine all of your organizations, use not only to drive your strategy and your planning, but also understanding what sort of impact you're having, either in direct services or advocacy or in partnership, as well as advancing equity. And a lot of the data we work with is to help organizations and coalitions understand where there are disparities in terms of access and outcomes. You can intuitively know that, you can personally experience that, but you can't quantify it unless you have the demographic data that allows for that kind of analysis. And finally, data, of course, is a requirement that often drives fundraising and grant writing and grant reporting. So it just benefits every organization of every size and scope to be really thoughtful about collecting data and to the point of this conversation, doing it in a way that is person-centered and trauma-informed. And there are definitely ways to do that regardless of whether you're collecting survey or administrative data and whoever you might be working with. So that's just kind of an overview of kind of how I think about data. A lot of the project, sometimes it's survey data to drive equitable programming. For example, I've been working with Tony Hawk's Skate Park Project nonprofit for several years. And over time, they've gone from a commitment to advancing equity in and making skateboarding and skate parks inclusive spaces. But they've over time learned how to gather, collect, and analyze data to identify specific programs and initiatives that can actually take that intuitive value commitment and transform it into concrete programming, which they're now doing today. All the way. Sorry.
I was going to say, can you just sort of say more, Jason, about that, about sort of something that you mentioned in terms of sort of person-centered and trauma-centered. And so when people are thinking about how am I going to get this data from someone who's coming into a homeless shelter or is looking for welfare, and in addition, ways to ensure that you're getting the kind of data but the process isn't so burdensome and overwhelming. I think that a lot of folks struggle with that.
Right. So I was going to try to jump to that other side where a lot of the data collection work I do and support is working with people in crisis. And I think your opening slide around how do you collect data when people are in vulnerable situations, and some of the reasons people don't want to give you demographic data is magnified or compounded when we're actually trying to collect data from people in crisis. So whether, I work with systems around 988 mental health crisis response and the recent transition of the National Suicide Prevention Hotline to a broader 3-digit toll-free number for anyone experiencing not only a suicidal crisis, but any mental health or substance use or behavioral health crisis. There's only so much demographic data you can collect. So while we would love to know the demographics of people calling or texting 988, that's not a reasonable moment to be asking a lot of significant questions. So you have to kind of scale what you can ask to the situation. But on the other hand, the U.S. Department of Housing and Urban Development does require every community's homeless crisis response system to ask very significant and detailed demographic questions. And that's a space I'm in a lot. And again, you're dealing with people in multiple forms of crisis, but yet we're still able to, across the country, collect significantly detailed demographic data on race, age, gender, sexual orientation, and even other things, mental health crisis, disabling conditions, other experiences. And that what's amazing about that as a model is not only can it be done, it is done every day. It can be done in a trauma-informed way. There are a lot of strategies that are used to do that. But what it leads to is there's actually a national database of comparable data across the entire country that defines, reports, collects and analyzes demographic data in the same exact way and is able to be reported and analyzed at national, state, and local levels and talked about the same way. So I'm happy to go into more strategies about how that actually works if that's valuable. But I think, just to be clear, yes, demographic data can be collected in a secure, private, person-centered, trauma-informed way, even with vulnerable populations or people in crisis.
And is that process kind of a post hoc process, but potentially, in other words, when people are out of immediate crisis or trauma, is when it's more feasible to get that kind of data?
So there's so this is a very local decision, and it's up to a local elected board of representative leaders to decide when to ask those questions. But I will say, in most of the communities I work in, they're asked at the first point of contact. There are some things that are required to be asked at the first point of contact, and demographic data is part of that required set. Again, this is homeless crisis response, not mental health crisis response. But there are ways to do it that I recognize that often people, it's not just that people, I mean, everything you talked about in term or shared in terms of, or why people don't want to share data. Let me just add on things I see, like the fact that they're being asked demographic data at a moment where they are in crisis or they're traumatized, or even the questions can be triggering depending on who's asking them and why. But I think the other nuance is sometimes people are, I think, struggle, and I know this is administrative data or participant data in many cases, but I think everyone struggles with what'll the data be used for, and what's the best answer I can give to make sure I get access to the services I need, or that my voice matters in an advocacy movement or coalition. So because unfortunately, I don't think systems are always clear, and unfortunately, they're not always, they're premised on some historical injustices that give, I think, people good reason to be concerned about sharing their demographic data.
Right. And so it sounds like what you're pointing to is still informed consent, is being clear, even whether it's around a trauma point, is to be clear about why these questions are being asked, to give people at least the opportunity to assess exactly what you said. Is this, what do I say that's going to get me what I want, but also how can I share information that will be helpful? There was a question, I think, in the Q&A about similar kinds of questions around immigrant status. Is that's something that's really, really, really critical, but obviously something very, very sensitive when at a point where you're maybe trying to provide services, and wondering if you have any suggestions around that. And then I think it would also be helpful to sort of specifically around sort of, what is collector bias? And maybe that points to people who were referring to data sets that are assumptions, but kind of speaking to some suggestions around getting data from populations like immigrants, and how do you check your bias?
Yeah, so there's so many things. I want to go back to something a question that was asked earlier in the Q&A round, which is, I want to echo what you said, Kelly. Self-reported demographic data is the best kind of demographic data, and I'm leery of any demographic data in which someone else guesses what someone's identity is. So, and I'd be leery of data sets. I know sometimes we have to use them, but the best data is self-reported data. And to make it person-centered, you have to make sure people have options. So a lot of, most of us don't define ourselves by categories. We define ourselves as individuals. And so one of the pitfalls of collecting demographic data, which I'm sure you've talked about, is what happens when we ask a question, but we all have a different definition of what the answer is. For example, if I'm asking someone, do you identify as Latino or Hispanic, and they identify as Puerto Rican, but I don't give them an option, that I'm limiting them to categories that are predefined that people don't relate to. And I also wanted to kind of loop back to one of the other Q&A questions that I think points to a strategy for being trauma and culturally informed, which is I'm a big I believe I'm a content expert, but not a context expert. So I know that we need to ask, for example, questions around LGBTQIA plus identity, but how to ask them. What I do is I go to context experts. I go to people who identify and say, how should we ask this question? How should we give this definition? I've learned a lot of things. I've learned things that many of you probably know, but I didn't know. Like when you ask someone their legal name and they're forced to give you what they consider their dead name, that's information that it doesn't relate to who they are. So I think if you're building or using your own demographic tools and you have the ability to customize them, you should actually share them with people who are going to be asked, or people who are context experts or have lived experience with those demographic questions, so that you can first arrive at the best set of questions and share definitions of what the answer choices are. But also, finally, that my third kind of tip along this line is there should always be an open-ended response. There should never be, you must pick one of these 7 race identity categories and that's it. Or, I mean, multiple is better, but best is, how do you identify and be able to collect that and analyze that.
That's super helpful. And I'm wondering if these sort of general good practices are also could be really helpful for answering questions like the person who raised her and asking questions around immigrant status. It's like once you have relationships with people who are undocumented or what have you, to ask them, this is why we need to know this information. What is a good way to get at it? What is a good way to engage it? What is respectful and appropriate around capturing that, so that we can provide the best kinds of services to you without putting you at risk, and at what point. So I think that that suggestion around when you're designing the tools and we talked about this the last time, you're going to have to, sort of walk a fine line between being inclusive and being accurate and being burdensome. But this is a real opportunity for you not to always have to guess or assume, but to engage your stakeholders in meaningful ways around these questions. I'm wondering, people do often talk about the issue around privacy and security, and so I'm wondering if before we get to the additional questions in the chat, if you can talk a little bit about what are some platforms and tools that people can search out, or that we can link them to, that help people keep folks' data private and secure.
Absolutely. So as you have on this slide there, you don't have to spend $1 million on a data system to use a secure data system. The tools range from Google Forms, SurveyMonkey. Smartsheet is basically an online collaborative spreadsheet program that's a reasonable subscription-based model. It has HIPAA compliance and other privacy protocols built into it. So when you look at that range of solutions, those are reasonably low-cost solutions, even for a smaller organization. But many organizations and coalitions also use some customized products that are intended for collecting and privately and securely managing confidential data, including demographic data, whether it's anonymous or not. And those systems include Ecovia, which has a product called Client Track, Social Solutions, there's Apricot, there's Clarity. Some publicly funded systems of care are required to report into these kinds of tools, but for, I think, probably many of the folks around this meeting, they aren't. They may not be required to. So if you're doing it internally as a nonprofit, as a foundation, as a coalition, you really can use a range of tools that would allow you to collect the data. And if you can't collect it electronically and store it electronically in a secure way, it's really hard to analyze it. Mm-hmm. So I think that just has to be, I think even, I would like social sector organizations to think about this as part of their infrastructure, not something that it'd be nice to have if we could afford it. But of course, I understand that there's often not funding to realize that commitment. And then strategies to protect personally identifying information. There are just I mean, when you're surveying and it's truly anonymous survey, you're not even asking, there are still ways that the survey fielding organization can identify you, especially if it's an electronic survey. But there are really good strategies to protect personally identifying information that are built into most of these systems or can be built into them, as well as strategies that are a little more homegrown. So for example, in a lot of the homeless crisis response system databases I work with, we provide options for people to remain. Well, first of all, there's always a consent. There's always a standard consent. And one of the consent options is to opt out of consent. It's harder to connect people with services, but not impossible. But another great option is anonymous protocols. So we de-identify information that is potentially personally identifying. And in some cases, we allow participants or end users to generate their own coding system. So they can generate their own basically username and password for their data in the system. And it's self-generated, only they know it and whoever records it. But these are all the different strategies that even, particularly with people who are not only vulnerable, but at risk. So for recent immigrants, for undocumented individuals, for people fleeing or surviving domestic violence or human trafficking, most of these systems have protocols in place to securely protect their personal data. And you can be very creative in workarounds to protect it even further.
That's helpful. Yeah, and I just wanted, cognizant of the time, I wanted to be sure that we see in the chat that some people have shared a couple of resources and some feedback around different platforms and how secure they are. So again, what we're talking about is security that has to be assessed for your particular purposes. But in the Q&A, folks have shared some resources and some information around not only other platforms, but also some tools and issues and forms around potential demographic surveys. What we're trying to get across here is that this is, getting this data and securing it is doable without a massive amount of investment. Having said that, it is important that people understand what it takes, understand what the kind of data that they need, what kind of consent they need, how to keep it secure and private, and then that they communicate with their funders and supporters what that actually takes. But it can be done, and we just want people to understand that there isn't that because there are steps that people have to take in order to secure that data. It doesn't mean that it's data that isn't important. And just real quickly, just I don't know if you just want to mention how important it is, because a lot of folks really operate in coalitions and in settings. How do people think about making sure that they're aligned with their peers and make the data meaningful and useful?
Yeah, that's a really great question. If you are participating in a coalition, a collaborative, a public-private partnership, or a network or system of care, for example, these, again, because I work within the homeless crisis response so much, I shared this image. If you're not uniformly collecting the data the same way, it is very hard to analyze the data collectively. So I believe this applies to individual organizations and coalitions. There should be an agreed upon set of questions, of answer choices, of definitions, as you see here. These are the forthcoming gender definitions from HUD for homeless crisis response systems across the country that are HUD funded. And not only do there need to be, again, a clear set of definitions, questions, and answers, but they need to be regularly updated. And I think actually HUD is excellent in the last few years of, first of all, soliciting input every year from grantees, service providers, and community partners around how should we update particularly our race, ethnicity, and gender questions, definitions, and categories. And then making sure that everyone's aware of that and everyone's doing that the same way. So there's really, my concern when I work with coalitions is that everyone's collecting demographic data, but they're all doing it slightly differently. Then they're doing it the way their organization does it, and then trying to share and compare, and that's just very difficult.
Yeah, and it really makes the data much less useful. So again, we're trying to build a capacity and awareness is how do you sort of observe good practice with respect to asking these questions and deeply engage the stakeholders and the people that you're engaging, and be sure that you're as much as an alignment with your peers and colleagues as possible. So I'm aware of the time, we're at 3:50. I'm going to go through the rest of the slides real quick because I do share some information about the some emerging field-wide efforts that are out there to standardize the process of collecting data, but we'll understand if people have to drop off. Be sure that the rest that assured that we that again we are recording, and we'll share the whole deck for everyone at the end. But one effort we did want to mention is that you may have heard of Candid, which was the merger of the Foundation Center and GuideStar has launched Demographics via Candid, where they're trying to encourage nonprofits to input their demographic data into GuideStar in one standard way so that it can then be accessed by a range of consumers so that it reduces the burden in terms of constantly responding to lots of different requests, and also ensuring and increasing the value that comes from the aggregate and analyzable data. There's still a lot of work going on to understand the best practice and how nonprofits are experiencing, but so far a considerable number of organizations have already started to put at least part of their data in. So we wanted people to be aware of that and to be aware of opportunities that people may be reaching out to you for your input on how that's being experienced. There's also Philanthropy Data Commons and Giving Tuesday Data Commons, which are entities largely driven by funders that's trying to streamline the data that flows into and around foundations, again, with a mind to reduce burdens. And a lot of that is focused on sort of sharing aggregate data and lowering technical barriers to sharing it. But again, it's early stages and a lot of research is going on to understand how impactful these tools will be. But we wanted to be sure that you were aware of them. It looks like we took a lot of questions as we went along, but we do appreciate the comments and the additional resources in the chat. We're going to take some of these questions and try and answer them in the supplemental materials going forward. For example, getting information from people who don't have a lot of technology. So we've captured your questions and we'll try to address them as we move forward in various ways. So stay tuned to going forward. The deck again will have a summary of what we covered today so that you'll be able to go forward. And Audra, now if you can just drop the link in the Q&A for the evaluation of the session. Again, that feedback is really, really important to us. Because we're trying to use it to refine and improve and strengthen the sessions as we go along. So the link should be in the Q&A. People can take that survey and give us some feedback. And then just a reminder, 2 weeks from now, we're going to have a substantive session on using the data. We're going to have some participation from another foundation outside of California who's been collecting and using data for some time. Hopefully we'll have more opportunity for folks to be in discussion with her and with colleagues. And then at the end of the session on the series on June 20th, it will be an open town hall for people to engage with the collaborative partners around how the motivation for this process, how they're going to be using the data, what they'll be asking you from, and just also as an opportunity for you to learn from each other, as folks have been doing by sharing resources and ideas and thoughts in the chat. So really once again,
sorry, really quickly, I won't be able to post it in the Q&A. I can only answer the questions, but we'll have to just send out the survey to all the entities.
Okay, we will do that. We will send that to you. So watch your mailbox for that survey and answer it. And we will see you in 2 weeks, hopefully. Thanks to everyone.
Thanks, guys. That went really fast. That was a lot of information. Again, I don't know how you do it, but yeah, that went really fast.
Yes, it did. It did go fast.
Lots of questions this time, though, so the engagement was there for sure.
I did my best to answer 4 of the questions in the chat that or in the Q&A that we didn't get to. So I typed the answers, even though people might have already left.
Great.
There's just so much to talk about.
There's so much to talk about.
Oh, yes.
And we will respond to these questions. And they're still folks along, so you're hearing our little backstory, but we're going to try and capture these the questions in the Q&A so that we can cover them going forward in supplemental materials. But we will sit out the survey. And thanks everyone who's still here. Stay tuned. We'll see you in 2 weeks.
Thanks, guys. Bye.
Thank you for the opportunity.
Okay.